And we've done that with adults too. So we do a graduated approach where we meet the client where they are. So if that client, and there are clients that are very comfortable with virtual therapy, but if you have social anxiety, virtual therapy works against you and actually makes that social anxiety worse. So we understand that, but we also want to move people into a place where they're fully functioning out in the world and they are able to get out of the house. So we work with them on whatever that graduated approach can look like, whether that means that they come 1 hour a week, whether that means sometimes even they come when nobody is there and we'll put them into that group room with a therapist just to get them acclimated to the room and to the surroundings. So it's sort of like we assess wherever that patient is, and then what do we have to do so that we can all work together to get that person back, and comfortable, and then in front of people, and then functioning. But we do it all on whatever that person's schedule is, because the most important thing is that it's successful. And I just saw the benefit of the groups. Groups are entirely different than individual therapy. It is not the same thing, and they do two very different things, and they both have their place. But groups, as you and I were talking, really have kind of fallen out of fashion, and I really think it's time for them to come back in because it's really what the world needs. Groups create, an enormous amount of internal community work, which is self-sustaining over time. So just like AA meetings or, all of these things that we know work really well, church, synagogue, temple, all of these things where people are meeting in groups and creating something that's greater than themselves. So that can happen in mental health, and it needs to happen in mental health. People, show more of themselves. They develop relationships, not just with the therapist, not just with themselves, but with each other. And those relationships that they create with each other, we want those to sustain over time. We want people to walk away with a community that they can call on, that they're not completely I always say people are getting better when you're not calling me. When you're not calling your therapist, and when you don't need therapy, that you want to come to therapy, but you don't need therapy because you have a community, you have your people, you have an ability to create that help yourself, then we're doing the right job. And we do give individual therapy while they are in IOP too, and PHP. So they still get individual work and very tailored treatment, but 100%, there's no way to combat this loneliness. We're in a loneliness crisis right now, really, where people feel incredibly alone and that they're the only ones that feel that way. And whether that's addiction or suicidality or depression, anxiety. And when we get that out in the public and people recognize, hey, you know what? As beautiful as she is and as outgoing as she is, she might have anxiety, But and that is just when somebody sees that in somebody else who they think that everything is going fine, they feel the relief.